You can help to contain the spread of the coronavirus. Wear a mask, wash your hands frequently, physically distance, and download the WeHealth Bermuda app today. How does the app work? After a person is tested, if they are positive for the coronavirus and have downloaded the WeHealth Bermuda app, they will receive a code from the Ministry of Health. The person will enter that code into the app, and WeHealth Bermuda will anonymously notify other WeHealth Bermuda app users that an infected person was in close proximity, even if they don't know that person. Because the WeHealth Bermuda app does not use or collect personal information or track users' locations, these notifications will be completely anonymous. WeHealth Bermuda uses Bluetooth signals to measure how long and how close app users were together. Once you download and install the app on your smartphone, the app will run in the background and alert you to any exposure risks. It uses very little data or battery life and will continue to work if your phone uses Wi-Fi only, as long as Bluetooth is enabled. We are using the power of technology to defeat the coronavirus. Download the WeHealth Bermuda app today. This message was brought to you by the Ministry of Health.
Good afternoon, everyone, and good afternoon, members of the media who are here today for this press conference. I am Walter Roban, the acting premier, sitting in for Premier Burt, who has had a well-deserved break over the holiday season. I am, of course, joined today by the Minister of Health, the Honorable Kim Wilson, and the Minister of National Security, the Honorable Renee Ming. Before I turn over the presentation to Minister Wilson, I would like to start this press conference by offering the sincere condolences of everyone on behalf of the government and the people of Bermuda to the family who unfortunately lost a important member of their family this past week as a result of the coronavirus. I know we all were saddened to hear of this when it happened. No deaths from the virus since May. So we all were moved by the announcement that someone had passed, the 10th person to die as a result of the coronavirus here in Bermuda. The reality of it, everyone, is that the pandemic is still with us. And there was a family, as a result, who was left with an empty chair over the holiday time. And I think we all understand, as a result of the past 3 to 4 weeks, that this virus is still with us. And we must remain vigilant if we are to fight and defeat it. I will now turn over the presentation to Minister Kim Wilson, the Minister of Health. Minister?
Thank you, Deputy. Good afternoon, Bermuda. I hope that you all managed to find your own way to make Christmas feel very special this year. This weekend, I was saddened to confirm that Bermuda had experienced our 10th COVID-19 related death. And I know, as the Deputy has shared, that the loss of one of our own to COVID-19 came as devastating news to our community over the holiday weekend, and our hearts and prayers continue to be extended to the loved ones and the family members of the deceased. I will now like to provide today's daily statistics. There were 715 test results received by the Ministry of Health since the last update, and 7 were positive for COVID-19. 4 of the new cases are classified as local transmission with known contact or sources as associated with known cases. The remaining new cases are classified as under investigation. These cases are among residents with no currently identified links to other known cases or history of travel within the past 14 days. Additionally, since the last update, 9 cases have recovered. Bermuda now has 602 total confirmed positive cases, and their status is as follows. There are 162 active cases, of which 158 are under public health monitoring, and 4 are hospitalized and none are in critical care. A total of 430 have recovered, and the total deceased remains at 10. The mean age of all of our confirmed positive cases is 43 years, with the median being 40 years, and the age range is less than 1 year to greater than 100 years. The mean age of all of our currently active cases is 38, with the median being 36 years, and the age range is less than 5 years, and that age group is from 1 to 4 years, to greater than 80 years, and that age group is 80 to 100 years. To protect privacy and confidentiality, age information will not be provided with respect to those persons that are in hospital when there are less than 5 cases. The mean age of all of our deceased cases is 75, and the median is 77, and the age range is less than 60, and that age group is between 50 and 59 years, to greater than 80, and again, that age group is between 80 and 100 years. The source of all of our cases is as follows. 157 are imported, 361 are classified as local transmission, of which 334 are local transmission with a known contact or source, and 27 are local transmissions with an unknown contact or source, and 84 are currently under investigation. As investigations proceed, transmission categories may change. Today's update has 2 cases moving from under investigation to local transmission with known contacts and sources, and 1 case moving from under investigation to local transmission with an unknown contact or source. The 7-day average of our real-time reproduction number is less than 1, being 0.55, and Bermuda's country status currently remains at cluster of cases. With New Year's Eve approaching, I want to remind everyone of the 11 p.m. curfew, which will still be in place tomorrow night. For many of us, this will mean celebrating in a much different way this year. Some of you may choose to celebrate in your own home at midnight with those in your household, and some of you may even pick another time in a different time zone in which to celebrate if you wish to bring in 2021 with others. But please remember the rules. No gatherings of more than 10 people. Now is not the time to socialize in large groups with people from multiple households. As I said last week, the ministry's contact tracing investigation strongly suggests that it is the social mixing of gatherings of people that are most likely to produce local transmission and positive cases. Remember that over the course of only 1 weekend in November, there were 3 gatherings of people at 2 venues, which resulted in more than 80 people testing positive for COVID-19 and more than 550 persons being quarantined. That was 1 weekend. We cannot be irresponsible about COVID-19, a virus that is so easily transmissible. I would again urge all of you to stop and think about your loved ones before you engage in any potentially risky health behaviors this New Year's Eve. Especially consider our elderly family members and the medically vulnerable. Our vulnerable populations require all the protection that we can possibly give them by shielding them from this virus. Also, can I just say that if you live with a senior or a medically vulnerable person in your home and they stay in while you are constantly going and coming, mixing with lots of people outside of the home, you are not shielding them. Yes, they may be staying in, but you are bringing the outside world to them. Your actions are their actions. Your germs are their germs. As I've said before, it is so important for young adults to realize that even healthy people in their 20s and 30s can catch the coronavirus, spread it to others, and suffer from severe illnesses resulting in hospitalizations, lasting health problems, or even death. Even if you don't get sick, the choices you make about where you go could be the difference between life and death for someone else. I want to remind also members of the public about current visiting restrictions at the hospital, which were put in place on Wednesday, the 23rd of December, and they are: long-term care residents and isolation patients on any ward will no longer receive visitors, while acute and critical care patients will be able to have one designated person visit for 1 hour. The Goslings ward, or the children's ward, will allow limited visits by parents only, and the maternity ward's visiting will remain as is, which is one designated support person able to attend the birth and visit once a day if the mother stays longer than 24 hours. I now want to provide a quick update regarding the COVID-19 vaccine. Preparations are currently underway for the receipt of the first shipment of the Pfizer vaccine in the new year. This will include just over 9,000 doses, which is sufficient to immunize 4,500 people. We are working to ensure that it is accessible to everyone who needs it first. Among those to receive the first doses will be the healthcare workers, essential workers, care home residents, and the medically vulnerable. The Ministry of Health has been closely monitoring the rollout of the vaccine across the United Kingdom, noting in particular any side effects experienced by the recipients. The common side effects are flu-like symptoms, including fever, headache, and body or muscle pain. Questions about pre-existing conditions and allergies are asked prior to the vaccine being administered, but on rare occasions, it happens that a person might not be aware of the severe allergies that they may have. Medical staff who administer the vaccine are equipped with the knowledge and equipment to observe and respond appropriately. We are currently in the process of locating additional sites across Bermuda from which to administer the vaccine, although in the first instance, a central vaccination facility is being planned. Rest homes will be serviced by a mobile team which administers the vaccine, and it is key to note that the vaccine will be available strictly by appointment only. Before I close today, I wish to remind travelers that those returning to the island without a pre-arrival test will have to be fitted with an electronic monitoring bracelet and pay a $300 fee. Additionally, a further reminder regarding travel, the ministry has put in place additional quarantine restrictions for those persons traveling to Bermuda from the United Kingdom or for those who have traveled in the United Kingdom in the past 14 days before arriving to Bermuda. Regardless of whether or not those UK travelers have a pre-arrival test, they will be required to quarantine in their accommodation for 4 days and cannot be released from quarantine until after their day 4 negative test results have been received. This will provide an added layer of protection for all of us. I will make a comment about quarantine generally. When the ministry directs you to quarantine for a specific period, you are told the date that you will be booked for another test so that the public health officers can make a decision as to whether you are ready to be released from quarantine. For example, if the quarantine is for 14 days, you will be booked for a follow-up test on day 14. However, we know that some people are booking their own tests on day 3, 5, or 8 in the hope that a negative test result will release them from quarantine more quickly. That is not correct. It will not release you from quarantine more quickly. There is no point in booking your own test or for your employer to demand that you do so, because the quarantine period is determined by the Ministry of Health, and the decision to release someone from quarantine is also made by the Ministry of Health. It is also extremely irresponsible to move about the island, going to different test sites or your doctor's office when you could be positive for COVID-19. Please stay put. In closing, I would like to remind the public about the availability of the Community Mental Health Wellbeing Hotline at 543-1111, and the line is open Monday to Saturday from 5 to 9 p.m. Be safe, Bermuda. Thank you.
Thank you, Minister Wilson. And I'd just like to personally thank Minister Wilson and her team under her leadership at the Ministry of Health for all their outstanding work. It's very clear over recent weeks they have been under a considerable amount of pressure. You all have worked very, very long hours, over weekends, almost 24 hours a day from earlier this year. So Minister Wilson and her team deserve this country's gratitude. They certainly get it from myself, and they deserve it from every resident of this island. And you deserve our gratitude and appreciation. I will now ask Minister Ming to make her presentation. Thank you, Minister Ming. Go ahead.
Good evening, Bermuda. This evening, I will address occurrences during the Christmas holiday and emphasize our need to continue to act responsibly during the looming New Year's celebrations. First, I wish to thank all of Bermuda for making responsible decisions and taking the necessary precautions to protect them and their families. Generally, we had a relatively peaceful holiday period. This is a testament to our residents who adhere to the health guidelines and advisories which encourage people to celebrate in small bubbles this holiday season. It is with much despair and sadness on my part to have received reports of a shooting incident on Monday night. I am sure that most of Bermuda shares in this sentiment. As in the past, I again condemn the actions of the lawless few who seek to wreak havoc in our neighborhoods and our communities. Monday night's incident was particularly awful, as from many accounts, it put innocent bystanders in harm's way, with bullets indiscriminately hitting people's homes. Thankfully, the young man who was hurt is not facing life-threatening injuries. However, we cannot let incidents like this become the norm. So I'm urging anyone with any information to please cooperate with the police and help us stamp out all forms of violence and antisocial behavior, particularly as we embark upon a new year. Also, in keeping with public safety, Bermuda, as a reminder, the curfew is still in effect until January 4th. So between 11 p.m. and 5 a.m., no one should be on our roads or out and about unless you have an exemption. As you would have seen, the Bermuda Police Service issued a public reminder that if you intend to be on the roads in the evening hours, please plan ahead by ensuring you have enough time to get home before the 11 p.m. curfew. Over the last weekend's holiday period, the Bermuda Police Service COVID compliance team, in partnership with the Bermuda Reserve Police, monitored our curfew checkpoints. These checks resulted in 15 persons being found in breach of the curfew. These individuals have subsequently been reported for summons. Tomorrow and into the weekend, the Bermuda Police Service will be out on the roads enforcing the curfew as well as speed limits to ensure the safety of the motoring public. They will also be conducting road sobriety checks, so again, we are encouraging you to make responsible decisions over the holiday period. At the Department of Corrections, in an effort to continue to protect our corrections officers, staff, and inmates, all visits by members of the public to our facilities remain suspended. We will assess the reinstatement of the visitation next month. As you will have heard the acting premier say earlier, an agreement has been reached with our 5 active Gombe troops so that they can have modified performances on New Year's Day. The Ministry of National Security assisted in ensuring that specific guidelines were put in place so that these performances can occur. So I think it's important to reiterate the guidelines. Do not follow the troops. Wear a mask at all times. Keep 12 feet away from the performers. Keep 6 feet away from other spectators unless you're members of the same household. And do not gather in crowds. Ideally, we would hope you enjoy the Gombe performances from your own home. Other than the Gombe performances, no large events have been approved for the holiday weekend. Remember, group gatherings are still limited to a maximum of 10 people per group. Lastly, as we embark upon a new year, I wish to close this one out by extending my humble thanks and appreciation to all our officers in the various departments that comprise the Ministry of National Security. I'm referring to the officers in the Bermuda Police Service, the Bermuda Fire and Rescue Service, the Department of Corrections, the Royal Bermuda Regiment, the Disaster Risk Reduction Mitigation Unit, the Customs Department, the Gang Violence Reduction Team, the Cybersecurity Section, and the support staff at the ministry headquarters, including one team member who demonstrated strong leadership and oversight to the team at the airport who have the responsibility for placing the quarantine bracelets on residents and visitors to Bermuda. Throughout this year, these individuals who, under strained conditions, adverse situations, and testing moments, ensured that our emergency services and agencies operated seamlessly. Through a pandemic, through hurricanes, through back-to-back vehicle fires, and most recently an island-wide blackout, the men and women in these departments have stood firm for the people of Bermuda. There were some extraordinary examples of courage. I'm referring to Sergeant Demir Armstrong and Corporal Nathan Frick, the two Royal Bermuda Regiment soldiers who were recently awarded Commander-in-Chief commendations for their. We also acknowledge our team of emergency medical dispatchers. Their empathy and clarity when responding to emergency fire and medical calls to assist people who are undergoing traumatic experiences must be applauded. They do it often under stressful circumstances, and I publicly recognize their extraordinary efforts during this difficult year. And a special thanks to our gang violence reduction team who have visited families, neighborhoods, and communities that have been devastated by gun and knife violence this year. They have provided support and guidance and have helped calm some of the most tenuous situations. These are just a few examples of the countless acts of sacrifice and commitment that we have all witnessed this year. I truly wish I could highlight them all. But to all of you on the front lines, know that we are heartened by your service. I wish to thank all of the families for also sacrificing your absence away from your homes to ensure that our island home remains safe. I am thankful to each head of department in the ministry for ensuring that they have robust strategies in place to reduce the impact of the pandemic on the workforce. They have all implemented measures to mitigate the spread of the virus and, as necessary, have worked diligently with the epidemiology and surveillance unit to manage COVID-19 exposure risk and to ensure that all their procedures and policies are in line with the guidance provided by the Ministry of Health. I know that the people of Bermuda join me this evening in collectively thanking you for continuing to safeguard and protect us under the unprecedented circumstances of 2020. On behalf of the Ministry of National Security, thank you for your stellar service, and I wish you and your families a safe, healthy, and prosperous New Year. I'd also like to take this opportunity to wish each and every one of you a safe and prosperous New Year and continue to make common sense decisions. Thank you, Bermuda.
Thank you, Minister Ming. I wish to join Minister Ming tonight in condemning the acts of violence which took place, unfortunately, on our streets Monday night. And as Minister Ming has said, encourage those who have information about this incident and any other gun-related incidences to contact the Bermuda Police Service. If you know something, you should say something. I would also like to express my appreciation to Minister Ming and the team under her at the Ministry of National Security for all their work, and especially referencing all the departments that Minister Ming mentioned tonight. They have all, along with the Ministry of Health team, done service beyond their call. And certainly the team and all the departments and persons at the Ministry of National Security have been working 24 hours to keep Bermuda safe. So I wish to thank them on behalf of all of us. This Christmas has, of course, been different for most of us in Bermuda. There have been smaller gatherings of our families, and sometimes no gatherings. Many had to stay within their social bubbles and exercise extreme care while moving around throughout the Christmas holiday weekend. I also heard some very heartwarming stories of families who found interesting and new ways to share Christmases with, of course, the use of technology. Some were Zooming, some were Skyping, all through the holiday period. Of course, using WhatsApp, which is a tool that keeps many of us connected. To everyone who worked to help reduce the spread of the virus throughout this holiday, I wish to, of course, thank all of you. While our Christmas celebrations this year may not have been like we're used to, but it's still been a good holiday. We still have our traditions. There is one tradition that we have been able to modify just slightly, and Minister Ming spoke to that a little earlier, and to the messages that the government has put out in reference to the Gombes. Yesterday, I issued a joint press statement with the Minister of the Minister of Youth, Culture, and Sport, the Senator Honorable Dr. Ernest Peets, giving guidelines related to how and where the Gombes will be performing through New Year's Day. If I can just add that the Gombes were very willing to support similar efforts over Boxing Day. So what we're doing on New Year's Day is a follow-on from some of the efforts that we worked with them to put in place for Boxing Day. And I wish to extend a sincere thank you to the leaders who are the Gombes and the troops who worked with the government agencies to find a solution that will allow them to perform safely for the public. The guidelines include that the troops performing between the hours of noon and 10 p.m. will be in groups no larger than 10, and no spectators, I repeat, no spectators will be allowed to be within 12 feet of the performers. Spectators must wear masks and keep 6 feet from each other. This will be enforced by a group of marshals provided by the Gombes themselves. The guidelines for observing the Gombes can, of course, be found where you can find much information about the virus and what the government is doing on the website coronavirus.gov.bm. I wish to extend the government's appreciation to everyone who worked hard to make this adjustment so that we could enjoy this important cultural experience possible. We all acknowledge that the Gombes are an important part of Bermuda's heritage, and I am extremely pleased that we can begin the new year of 2021 by observing and continuing to celebrate this very important part of our culture. I will now talk about the help that is available to everyone and to those who are not working, perhaps due to no fault of their own, certainly no due fault of their own, and what the government is doing to support them. In recent weeks, the Ministry of Finance has paid $234,000 to those who are not working and others who have been directly impacted and had to quarantine. The first group are verified as employees of bars, nightclubs, and members clubs that have been closed due to the current COVID-19 restrictions. The total benefit for these people is $500 a week for the period that these restrictions are in place. The spirit of this benefit is to compensate individuals who work at these establishments and have been unable to earn an ordinary salary. The initial benefit for 4 weeks, or $2,000, has been paid to individuals who completed and submitted the proper application process. This included verification from their employer. The government may extend this benefit further if it is seen to be needed to do so. Those who have submitted their application and not received information or payment should contact their employer to make sure that they have completed the necessary documentation to support their application. So far, 74 people have been paid a total of $148,000. The other group that has been approved for financial support are individuals who have been directed into mandatory quarantine or isolation by the Ministry of Health. These individuals who are unable to earn an ordinary wage or income can apply for this benefit. Starting on the 18th of December, these individuals have been paid bi-weekly. The benefit payout will be calculated at 60% of the individual's remuneration with a maximum of $500 per week. 116 applications have been approved and a total of $86,600 has been paid. I will now move to my own ministry, the Ministry of Home Affairs. We have detected fraudulent activity that has been brought to our attention through the Office of Consumer Affairs. There apparently are some members of the public who are going around to retail establishments and saying that they are consumer affairs enforcement officers. And this is obviously in order to deceive these retailers. The offenders operate in small groups to intimidate retail staff. I want to make it clear this is an offense under the Consumer Protection Act of 1999. And the offender or offenders is liable for a summary conviction and a fine of up to $10,000 and 6 months imprisonment. Consumer affairs enforcement officers actually wear badges and have the appropriate ID on them. So if you are approached by someone who's claiming to be a consumer affairs officer, immediately ask them for their identification to verify the person is who they actually are. If the person does not provide the badge or ID, immediately contact the Bermuda Police Service and provide the appropriate physical description. If you know the person, please give their name to the police as well. If you find that you have been a victim of any fraudulent behavior of this nature, please file a complaint immediately with the Office of Consumer Affairs. And please call the number 297-7627 so they can investigate and ensure proper prosecution of the offenders. I will now talk about the WeHealth Bermuda App. The app was, of course, launched on the 11th of December. It has been almost 3 weeks since its launch, with 17,500 people have downloaded the app. If you don't already have the app, you can download it from the Apple's App Store or, of course, Google Play. You can find it by searching for WeHealth Bermuda. And let me remind you that it is free. The WeHealth Bermuda app is designed to help slow the spread of the virus by notifying app users of the potential exposure to COVID-19. It is one of the most sophisticated apps available anywhere in the world for helping to control and minimize the spread of COVID-19. When smartphones that have the WeHealth app installed enable Bluetooth and exposure notifications are near each other, the app uses anonymous Bluetooth signals to determine how close the devices were and for how long. Once a person receives the positive COVID-19 diagnosis, and if they have the app on their phone, they will be issued with a random verification code by the Ministry of Health. He or she will enter the verification code into the WeHealth Bermuda app, which will automatically and anonymously notify app users that they have an infected person within their proximity, even if they don't know that person. Because the WeHealth app does not use or collect personal information, these notifications are also completely anonymous. The app is free, and once you download and install it into your phone, there's nothing else you need to do. The app will run in the background and will alert you to any exposures or risks. To help contain the spread of the virus, of course, the reminders that we've been giving at every press conference: wear a mask, sanitize your hands, and practice physical distancing. And of course, please download the WeHealth app to continue with the fight against COVID. And also, please encourage your friends and family and co-workers to do the same, to download the app too. If you have any questions about the WeHealth Bermuda app, visit www.gov.bm/WeHealth or email COVIDapps, COVIDAPPS, @gov.bm. And in closing for my remarks, I want to, as my colleagues have already done so, remind everybody, firstly, of please follow the restrictions, please follow the guidelines, and continue to do so that we can be successful with dealing with this virus through the New Year's. And a reminder that the curfew, as ministers have already stated, is from 11 to 5 a.m. There can't be any gatherings of more than 10 people, and you are strongly encouraged to remain within your social bubble, and no more than 3 households coming together. As with Christmas and other events in the year, we will have to find new ways in 2021 to celebrate. Many of us will, of course, be in our homes celebrating with family and friends, near and far, and using technology to ensure that this can be done. 2020 has been a very tough year for everyone, and maybe a year that we do not wish to remember, because we have had to change so much of our behavior, modify how we work, how we attend school, all of our routines. We've had to learn to wear a mask when we were told for many years you don't wear a mask. We've had to wash our hands just like we were told as children, regularly, and physically distance, which is not a Bermudian cultural practice, of course. We like to be together. We like to stay together. But throughout this, we have all recognized what is truly important in life, I believe, and have hopefully grown just a bit closer, even though we've had to be apart, and learn more about each other and come to love each other a little bit more than we perhaps did in the past. There are many in our community who, through this period, have needed extra support emotionally. And we all have experienced perhaps high levels of stress, anxiety, and uncertainty and fear. So if you need to talk to somebody, there is help. The Bermuda Psychology Association continue to support the Emotional Well-Being Hotline. The phone number is 543-1111. Again, I'll repeat it, 543-1111. The line operates from Monday to Saturday from 5 a.m. to 9 p.m. Please call that number if you do feel anxious. Caregivers and coping with, if you're a caregiver and you're coping with family, particularly a member who may have certain conditions such as dementia, seniors who may feel isolated, having a hard time just with having to be isolated, or you're caring for loved ones and just need to have a chat with somebody. There is, of course, no charge for this service, and funding is made possible by the Bermuda Foundation with the support of the Health Innovation Fund. We all have worked together as a community to understand this pandemic and the role that we all can play with stopping its spread. I wish to again thank everyone, especially all those essential workers in the healthcare, the public service, in our grocery stores, and other agencies that provide helping services, and of course the charities which are hardworking and have been working all through the year to provide support where it is needed. Additionally, there are many who perhaps don't fit these categories that I've mentioned, but it's important that we remember them as well. Our strength was tested as a community, as an island, in ways that we had never seen before in the year 2020. We bent, but we did not break. We have proven that we can be creative and innovative, but also resilient and determined. We identified new ways to provide ourselves and to take care of ourselves, different products, different services, and we built on the success that our country has already had and has allowed us to survive as a little piece of limestone rock in the middle of the Atlantic Ocean. And we have worked together to survive and to provide each other support. On this eve of a new year, I again thank everyone who has made a difference in all of our lives. And I wish, as my colleagues have already done, wish everyone, members of the media who are here today, and those who are listening and watching, a very peaceful, healthy, and prosperous 2021. Happy New Year's to all of you, and thank you. I now will take questions, as will my colleagues from the media.
Good evening, Owen Johnson Barnes with the Royal Gazette. I'll start off with, I have a few questions about the vaccines. First of all, do we have any update on the COVAX vaccines, when they might be arriving on the island, when they might be coming, that sort of thing?
The last update that I received indicated that the COVAX vaccines would probably arrive at the end of Q1, so end of February, March. We're anticipating that. That's the last update.
And of course, we were supposed to be getting 9,000 vaccines on the island very soon. Can you say, do we have any information about follow-up shipments? Obviously, having 9,000 is a fantastic start, but will we not get any more until later in the month or February or?
Those discussions are taking place between ourselves and Government House through the Foreign Commonwealth offices. They have indicated, they meaning the United Kingdom, that they will be providing to Bermuda as well as the other OTCs the same level, the same proportion in which they receive themselves. So we are certainly anticipating far more shipments as well, in addition to the 9,000 that we anticipate getting very soon. However, with respect to a definitive date, we don't have that information as of yet. But certainly when that information becomes available, the public will be made aware of that.
Now, the UK is also moving forward with the AstraZeneca/Oxford vaccine, which I understand got some green lights today.
Yes.
Are we optimistic about getting that within the near future? And is there a plan to distribute that amongst the public?
The discussions that we've had from COVAX have indicated that they would be looking to either the Moderna and or the AstraZeneca. Whichever ones they are able to acquire the soonest will be the ones that will be received by Bermuda and the other OTCs.
Now, of course, with all the vaccines rolling out, there is still a degree of skepticism among some members of the community about the vaccines and their effectiveness and side effects. Will there be any sort of informational campaign or promotional effort to make people aware of what the vaccine is and let people know that it's safe?
Absolutely. Just like with this vaccine and all the other vaccines that have actually been on the market or that have been distributed throughout Bermuda, we have always followed up with an educational awareness campaign that includes having meetings and Zoom meetings so members of the public can hear from the OCMO as well as other doctors and physicians. It includes educating not just the members of the public, but members of the medical profession and so forth. So there is a full educational awareness campaign being planned, and you'll start seeing developments of it very, very soon.
Now, we did have one question from a reader regarding the tracking bracelets, specifically their use among younger people who are traveling in. Can you explain what the policy is regarding people who are under 18? Do they get the bracelets? And if they're not given the bracelets, are they tracked in any other way?
When you say the tracking bracelets, you mean the
yes,
8-day ones?
the
I'm going to
traveler
yield to Minister Ming.
Okay.
That is coming, an initiative on national security.
Sorry, and you said the question was someone under the age of 18 be
Under the
required
age of
to-
18, will they have to require it? What tracking measures are in place for people who are younger?
I'm not sure, I mean, and I can find this out for you and confirm it to you, especially if you've had it as a question, if the age is 18 or 16. So I will endeavor to get the answer, and I can reach out to you so that you can answer your reader.
All right, well, thank you very much. The other question I had regards the curfew. Obviously, the curfew is right now scheduled to end on January 4th. I don't believe we're going to be having another one of these meetings until after that date. So can you say if there is any intention for the curfew and those similar measures to be extended beyond January 4th?
We have a COVID cabinet subcommittee that meets regularly, and part of those discussions also entail looking at whether or not there should be further refinements to any of the rollbacks that we're seeing right now. So no determinations have been made at this point. However, it's important to note that in addition to us meeting very regularly, a lot will be determined upon what we see following the New Year's events. If unfortunately we see and or hear that there has been a lot of social mixing of families and the socialization that we've already seen that has resulted in quite a number of recent positive cases and increasing our transmission levels here in Bermuda as of late, then those are certainly circumstances that we'll have to explore to see whether or not there are further refinements to the existing rollback measures, so to speak.
Thank you all very much. Happy New Year.
Happy New Year to you, too.
Just as an addition to what the minister said, I think we've obviously seen some reduction in the amount of cases that we have been detecting from the spikes that we had a few weeks ago. If that trend continues, and I can only speak to it as a trend, perhaps there'll be no consideration of that. But as the minister said, it'll be all dependent on what we are experiencing post this last sort of period, I guess, celebratory of the holiday. So it's important that people follow the guidelines as it's been outlined and be mindful of the restrictions that we put in place to fight the virus.
Good evening.
Good evening.
Acting Premier, we know that the U.S. Consul General Lee Rizzuto told Premier Burt recently in the presence of Governor John Rankin that he was willing to get the remaining vaccines needed to cover 40% of this country. Has government taken him up on his offer? Why or why not?
That's a question I think you should save for the Premier when he returns next week, since that would have been a conversation within the precinct of he and the governor and representative of the U.S. government. It's perhaps more appropriate that you put that directly to the Premier and he can give you the answer on that.
Okay, thank you very much. Health Minister, the U.S. Consul General wrote directly to you on 2 separate occasions recently offering to help provide vaccines for Bermuda. Can you please tell us what your response was?
I have heard that he did write directly to me, and I've actually reached out to my team to make sure that the address was correct, because I do not recall receiving any information from him, but unfortunately sometimes people forget the N in my name in my email address. So I actually spoke to the Premier prior to his commencement of his vacation to invite the U.S. Consul General to send the email again and make sure that it was sent to the correct address. Because as people will know, I generally do respond to all of my emails, and certainly if it was an email dealing with such an important issue, I would have responded.
Thank you. Mr. Roban, over the past 3 weeks, more than 40 countries have started vaccination programs. Would the government object or block private medical practices and organizations from bringing in vaccines to help speed up the process? Or does the public have to rely solely on the government to deliver the vaccines in 2021?
I'll defer, because that's really a matter of the handling of the vaccine for the country. I'll defer to the Ministry of Health on that.
Don, I can't answer that because that's the first that I've heard of it, of private agencies attempting to perhaps help secure the vaccine. As I've indicated previously, we have two streams of obtaining the vaccine. First is through the United Kingdom and the FCO and through Government House, and then the second, obviously, the COVAX facility. I've not heard that. That request hasn't been made known to me, so I really am unable to comment.
Okay, thank you. Health Minister, many countries and airlines around the world are saying that in the near future, travelers will need the vaccine certificates before being allowed in entry into countries, as you stated over the last couple of press conferences. Why is Bermuda still allowing residents to land at the airport without a pre-test? And if countries can stop people traveling without a vaccine certificate, why can't you stop people arriving here without a pre-test?
That's a larger issue. We have a document that's a living, breathing document called the Constitution, and there are some restrictions potentially with respect to interpretation of the Constitution as it relates to the travel, freedom of movement of residents of Bermuda. So those are some overarching issues that must be considered as it relates to entry into Bermuda. However, what we have often encouraged residents is that non-essential travel should be restricted. You should not be going away unless it's for essential reasons, which is one of the reasons why we have taken steps to increase the fee to $300 for persons arriving without a pre-arrival test. And persons that are traveling, to ensure that they take steps to have a arrival test. You would have also heard us announce through the BTA the ability to utilize Costco, which has over 120 various locations throughout the United States that offer the COVID PCR test, or alternatively, you can go into your shopping cart, download it, and get it online, have it delivered to wherever you're staying, take the test, and then send it back and get your email results of your PCR. So there's a number of avenues that have been made available to persons traveling to ensure that residents arrive with a pre-arrival test.
Thanks. Sadly, a person died over Boxing Day from COVID complications. In the official press release, it stated the person was one of the previously hospitalized cases. How long had the person been released from the hospital before passing, or were they still in a hospital but no longer listed as a COVID-19 patient?
The person that passed away was still in hospital.
Still in hospital. Okay. Thank you. And finally, as we head out of 2020, thankfully, into 2021, what can you say to the Bermuda public about having a better year ahead with the vaccine on the horizon?
You know, Don, 2020 has been a horrendous year for many, many Bermudians worldwide, but let's speak locally to Bermuda and her residents. And a lot of people have suffered as a result of certain of the issues concerning the pandemic. I myself personally, as well as I'm sure many other Bermudians, still feel very, very blessed that we have wonderful families and we have our health. I also feel blessed that I have had the opportunity to work with a tremendously dedicated team at the Ministry of Health. I have not carried the COVID battle alone because I've had the support of the team at the Ministry of Health as well as the government in whole. I think that recognizing that the vaccine is not going to be a panacea. We are going to still be in the midst of this pandemic next year as well. We will still be required to wear our mask and physically distance, and all the other public health guidelines will also still be required. However, recognizing that the vaccine will certainly be an enhancement to the regime that we have with respect to trying to fight this particular and a particularly deadly virus by use of the vaccine. We've spoken about the importance of people becoming vaccinated. The government has said over and over again, we will not make it mandatory. However, it will be made available to each and every Bermudian and resident who wishes to have it and avail themselves of it. And we are certainly encouraging people to do so, not just for themselves, but for the protection of the community as a whole. So in sharing my colleagues' sentiments, I too wish all of Bermuda a happy and healthy 2021. 2020 was very horrendous. I know a lot of us are happy to see it in the past. However, 21 will be difficult because we will still be living in the midst of a pandemic, notwithstanding the availability of the vaccine. So we'll still have to continue to physically distance, wear our masks, and follow the other public health guidelines. But we'll come out a lot stronger because we've weathered the storm of 2020 together as a community by all pooling together to adhere to the guidance, and I anticipate that we will continue the successes of that in 2021 with us all working together to fight COVID.
Thank you. May all three of you have a very happy New Year.
Thank you. You too, Don.
Good evening. Traveler Lindsay from TNN. Minister, out of all the positive cases, how many, Minister of Health, I should say, out of all the positive cases, how many been symptomatic versus asymptomatic? Do you have the numbers?
Approximately 40%. That's consistent with worldwide averages, that approximately 40% of persons that test positive for COVID-19 are asymptomatic.
Okay. My next question, what is the cycle rate for PCR tests here in Bermuda? And are both labs using the same cycle rate?
I wonder if you can be a little bit more specific insofar as what are you referring to, a cycle rate?
PCR testing.
Yeah, I'm familiar with the PCR testing, but I don't know what you mean by the cycle rate.
I'll pull it up. Let me go to my next statement first,
Okay.
and I'll come back to that.
Thank you.
My next question, Minister, would there be a choice of vaccines people can choose from, especially with health conditions?
That is a question that is not yet to be determined. We do recognize that some of the principal differences between the vaccines is with respect to the way that they're transmitted and whether or not they have to have the cold storage and so forth. But insofar as whether or not a person can opt for the AstraZeneca or the Moderna versus the Pfizer, those final determinations haven't been made yet.
Okay, that I'm going back to the other question. What I'll do, I'll email you it's a very large questionnaire, so
Okay,
I'll
you can ask them to.
email.
Okay, that's fine.
I'll email it to you.
That's fine.
Minister of National Security, a convicted sex offender was released after serving supposed to be 5 years. He was sentenced to 5 years in prison last February. He was released on Christmas Eve this year. Why wasn't the public advised on his release?
Sure. First of all, Trevor, thank you for your question. And the ministry does not actually speak to specific inmate cases. What I can say is that the granting of parole is subject to a specific criteria, and it would be if there was a public notification that had been determined, that would come from the Attorney General's chambers.
Thank you. Okay. Back to Minister of Health. Last Tuesday, the CDC released a statement. Matter of fact, last Tuesday morning, they released a statement stating Bermuda as being a high-risk COVID-19 location, as our positive numbers for at least 3 weeks were in double-digit figures. Since then, reports on that same date, here in this press conference, I think it was last Wednesday night, we had 6 positive. The next night, we had 0. And a few days after that, up until today, it's 14, 20, and 7. Why and what happened? Why and since then, why or what has happened for these positive numbers to change? As many have noticed, the fluctuation and change. Is it since this report, I guess?
Okay, if I understand your question first, the one thing is with respect to the level 4 rating that the CDC provided to us recently, and that was as a result of.
Has the level changed?
No, not to my knowledge, but that was, it's a peer, there's, if you look online on the CDC website, it speaks to the level, and I want to say it's 150 over a series of 7 days or something, but it's specifically spelled out by the CDC. Insofar as us getting that level to be reduced, or for that change, you'll recall similarly we had a situation, I think it was around May or April, where they inadvertently placed Bermuda on a different category that wasn't consistent with the level of clusters of cases that we had in Bermuda. We were at sporadic cases, and they incorrectly identified Bermuda, which of course was adversely affected our tourism product. However, having said that, we will continue to monitor the status, and if our hope is that we will continue to see a reduction in our cases, and at that point the CDC will be approached so that they can make the requisite changes to their classification, because they do review it from time to time, but they also look at the real-time reproduction averages as well as the number of cases. And because we are on a downward trajectory, you'll see our real-time reproduction was 0.50 today, so we'll continue with that. Then it is anticipated that our level 4 standing will also change.
Have you noticed a change since we've been into this curfew time period? Have you noticed a change in positive numbers coming down?
Well, you would have seen, let me answer that in 2 ways. One, you would have noticed in the last couple of days we have seen a reduction in our numbers. However, as I said previously, many of the local transmissions have been as a result of the one particular weekend in November. We've spoken about, and I know this is Dawn's favorite conversation, concerning the modeling and the lead and lag measures. And oftentimes, whenever you introduce mitigants such as curfews or changing the times of restaurant operations, et cetera, it oftentimes takes between 2 cycles, 14 to 28 days, before you will actually see any type of results as a result of the introduction of the mitigants. So we're still in the early days of that second cycle to see what, if any, impact the introduction of the curfew, as well as the other mitigants and the rollback measures that were introduced by the government a few weeks ago, what impact they will have. And our hopes is that we will see positive impact, and we will continue to see the cases decline on a day-by-day basis.
This is not a statement, this is not a question, it's a statement. As we close tonight, that's our last press conference for the year. For the first time in many years, we haven't had a Christmas or a Boxing Day baby. And I agree with you, 2020 has been a hard year. Not even babies are going to be born this Christmas. Have a Happy New Year to you.
Happy New Year, Trevor.
Before we close, I would just like to turn the mic back over to Minister Ming, who I believe a question was presented by Mr. Burgess, and she has an answer for his question, one of his questions.
Surely. Mr. Burgess, you asked about the monitoring bracelets, and the monitoring bracelets are used for persons 10 years and over, in line with the COVID swab, and the yellow wristbands are for persons aged 16 and over. Thank you.
Okay. All right, with that, everyone, thank you for all of the media and everyone who's here tonight to ensure that this press conference can happen and ensure that we are able to inform the public. I would like again to wish everyone who is watching and listening a safe and peaceful New Year's celebration, as well as a safe and peaceful 2021. 2020 has been tough, but let's move into the next year with some optimism and a sense of purpose that we can defeat the virus and begin to bring Bermuda back to a place where we all will be more happy and will feel that our country is moving forward. And with that, I wish to wish everyone in Bermuda, again, a peaceful and prosperous New Year, and of course, good night.